This is Christine Porter with the Times News. I'm here today with Daniele Shollenberger, a nurse practitioner and director of the Concussion and Head Trauma Program at Lehigh Valley Health Network. We are talking about treatments for concussion. How are concussions managed and treated there at the LVH Concussion and Head Trauma Program?
Once we have the data that I just described to you, once we have the symptoms and their ratings, and then we have the assessment of their neurologic function, their vestibular function, and their ocular motor or eye movement function, that's when we then make an individualized plan of care for that patient. Now, first of all, that may include modifications of how they live their life. We call it activities of daily living, but how they do what they do in their home or what they do or have to do in school. So we use a lot of academic accommodations for students. We may give them a list of many accommodations based on their findings when we assess them. And that may be extra time to complete tests, extra time to hand in their due work, their assignments, their projects. If you're an adult and you're working, we may place restrictions on some of your job duties. For example, you may not be able to climb a ladder, or you may not be able to lift certain amounts of weight. So that's the next level. And then finally, we prescribe specialized therapies.
Are there any long-term effects from a concussion that was of a serious nature that maybe someone doesn't realize is resultant from it?
The long-term effects of concussion are most significant when left untreated. So this is I could talk about this for a very long time, but I will try to keep it short. But what I want everyone to hear is that if you have any of the symptoms that we spoke about, if you are concerned or even unsure, you should be evaluated, because the treatment for concussion is specialized therapy. It's vestibular therapy, cognitive therapy, vision therapy. A neurooptometrist is involved. These are very specific treatments that have been tried and true by research. And if you do not have the treatment, again, everyone will say, well, I don't have headaches so much anymore. But what we see is that there will be long-term cognitive effects. So you will have trouble thinking and remembering. You may still have physical symptoms. For example, people can no longer sit in the back seat of a car or go on a ride or be in a closed space. And you also may have personality changes. Now think about all these things I'm saying. They can be related to other things as well. So that's why they get missed. And then long term, people will have changes in their personality and the way that they can think and function. And we don't want that to happen. That's not what should happen, because we have the mechanism to treat. Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.